may know, my background is Armenian. Armenia is a little country in uh, Eurasia, and we have just started a study, believe it or not, in Armenia to ask that question. So we are giving a group of individuals vitamin D or not vitamin D, and we're going to track them to see whether or not vitamin D is protective against COVID. I don't think there have been any studies that have addressed that question. And as of this week, we have started that study in Armenia. So I'll be able to give you more information maybe in 6 months.
Maybe next year in person.
For sure.
And then another question is about, is any risk with high doses of vitamin D we can use weekly for a long time? What do you think?
Yes, we used to say that vitamin D is very safe. And you can use a lot of vitamin D, and you can get to levels of 100 nanograms per ml, which is like 250 nanomoles per liter, safely. We used to say that. And we're now not saying that because there have been some indirect epidemiological data to suggest that when you get to levels greater than 50 nanograms per ml, there is an uptick in the curve related to cardiovascular disease. So most of us are now saying that 50 nanograms per ml, or maybe a little higher, is where we want to be. But let me just make one other comment. There have been some studies that have suggested that for the immunocompetent aspect of vitamin D, we need levels that are not 20, 30, or 40, but even up to 50 or 60. So it's a moving target. But if you ask me what levels of my patients are at, they're rarely over 50. And I think that's a very safe number. And you won't get into trouble if you shoot for levels 50 or maybe 60, but not much higher.
Okay. Another question from the Dr. Angelica Valdivia is about vitamin D in fasting with foods in the morning or late by night. In practical, what is your practical recommendation?
Yeah, we have said that it doesn't matter whether you take vitamin D morning, noon. We have said that it doesn't matter whether you take vitamin D with food or without food. Vitamin D is a fat-soluble vitamin. And, we were thinking, although we're probably not right, that vitamin D would be absorbed better with a fatty food or, a fat, because you're absorbing fat. But there is a competition that is set up when we have a fatty food and vitamin D. So most people are saying you can take vitamin D with food or without food, but not to take it with a fatty food, a lot of fat in the diet. So there really isn't a lot of instructions here, except for perhaps staying away from a fatty meal when you take your vitamin D.
Okay, and there is another question. What about with the bones? If the level of vitamin D is above 100 nanograms per deciliter, is any risk?
Oh, 400 nanograms. Oh my goodness.
100 nanograms.
Oh, 100. I understand. Okay, 100. This is what we say, and I think it's probably true. In terms of the skeleton, vitamin D doesn't seem to be detrimental until you get to levels around 200 nanograms per ml. That is very, very high. 100 nanograms per ml. In fact, I saw a patient just the other day on a laboratory in the United States, and it still is saying that the normal range is up to 100 nanograms per ml. They haven't changed their normal range yet, when most laboratories are saying 50. But even 100 nanograms per ml is probably not detrimental to bones. levels of 200 nanograms per ml is a point. Let me make a point. You might be interested in this. I don't know if there in in the the Caribbean countries, Dominican Republic, Puerto Rico. We have a lot of patients, of course, from those countries. And we saw a large number of patients who had levels of vitamin D that were 200, 300, 400 nanograms per ml. And they had a high calcium level and they had terrible bone disease. And we could not figure out why their levels of vitamin D were so high. And then we found out there is a product in the Dominican Republic. It's called Solidec. It's a little clear liquid, and it says Solidec, and it says vitamin D and vitamin A, and it has instructions in Spanish. You are to take it if you have a headache or if you don't feel good, you know? And we found that these people were taking this little swig of vitamin D every day. In this little vial of Solidec, there were 833,000 units of vitamin D. Amazing levels. Now, I don't think I've heard of any cases in South America, but it's something to bear in mind.
Okay. What is your opinion about the following time or the follow-up time in these studies about vital beta and D2D? Do you think it's enough time for cardiovascular disease or for the outcomes that you presented? What do you think about the study of Professor Joan Manson?
Yeah. Well, they were relatively short when you look at a long view here. So it is a good point that maybe if they continued the study for longer, they would have seen a difference. But, I don't think so. I think that study and the New Zealand study, and to a certain extent, the diabetes study, they were flawed by they used a population that already had normal levels of vitamin D. And if you start with normal levels of vitamin D and you give more, it's not necessarily going to be better. So the doctor is right. Maybe if they carried it out longer, there might have been a difference, but I am not sure. I think unfortunately, I think the experimental design was not ideal.
Okay. And what do you think about the pregnant women and vitamin D? Is necessary any supplementation? And another question is about neurological diseases. Is any relation between vitamin D and neurological diseases?
Yeah. Well, getting to pregnancy, of course, is very important for women to be vitamin D sufficient. And the prenatal vitamins have vitamin D. I think all pregnant women should be tested for vitamin D.
Okay.
And if they are deficient, they should definitely get it. It's very safe in the amounts that we would use. In terms of neurological disease, that's an interesting question. There's one disease for which there seems to be very good evidence, but this is epidemiological, between vitamin D deficiency and multiple sclerosis. It's very interesting. It's a very powerful relationship. That is, those individuals who get multiple sclerosis tend to have much lower levels of vitamin D. But nobody has shown that if you give vitamin D to these individuals, that the multiple sclerosis is going to be improved. So there is a different kind of relationship that may be related to risk for getting the disease. But neurologically, it's very interesting that of all the various diseases that we've talked about, breast cancer, cardiovascular, diabetes, obesity, multiple sclerosis is probably a more powerful relationship than these other disorders.
And there's another question about colon cancer. It's some specific relationship between vitamin D deficiency and this kind of cancer?
Yeah. That's a very good question. And this work was done by David Feldman at Stanford University. And it's very interesting. There might be something specific about colon cancer that is related to vitamin D, different from these other cancers. So the doctor is right. There does seem to be, uh, and nobody knows why, the vitamin D and colon cancer seems to have a different relationship, and more importantly, than these other cancers.
Okay, and your relation with the previous question, there is any contraindication for the use or the supplementation with vitamin D?
I'm sorry, what is, I didn't get that part.
There is any disease or clinic contraindication or risk for use of vitamin D
Oh, I
in,
see.
in this? Mhm.
Yeah, I'm thinking, would there be a reason why there's one? Um, there's one. It's my favorite disease, uh, primary hyperparathyroidism.
I know that.
Yeah, I mean, we actually, I'm in the middle of a world, as you know, Miguel,
Yeah.
this world conference, and there is a very interesting discussion about vitamin D and hyperparathyroidism because these are people who have a high calcium, and you give vitamin D, and
Mhm.
vitamin D, you're going to make the disease worse. But on the other hand, you may make the disease better because
Okay.
vitamin D deficiency might make the hyperpara worse. So that is an example where you have to be careful. And we are going to recommend that vitamin D and hyperparathyroidism should be given if the vitamin D is low, but it should be given very carefully so we don't make the hyperparathyroidism worse. And then the other point would be any hypercalcemic state, not just hyperpara, one would have to be careful. Not that you wouldn't use it, but one would have to be careful.
Okay. Okay. And there's a couple of questions. One is about what do you think is the time of the exposure for get good vitamin D levels? What
Yeah,
how many hours?
yeah. So of course, this depends on where you are in the world
Mm-hmm.
and what the season is. There have been studies in Boston, Massachusetts, during the summer that has suggested that only 20 minutes of
Okay.
sunlight during the day in the summer is all you need. Um, there haven't been a lot of studies on that. Let me give you some examples of how the sun, I'll give you two examples. There was a very interesting study of lifeguards in Hawaii. And these are men who are out on the beach during the summer, and their skin is exposed and they get full sun all the time. And they were not wearing a sunblock, so they were getting all the sun. And at the end of the summer, their vitamin D levels were checked. And the average level among these lifeguards, full sun for the whole summer, was 60 nanograms per ml. So
Six.
that's a very interesting study because it suggests that the skin has a limit beyond which it's not going to make any more vitamin D. The other study is also very interesting. This was a study of individuals from Africa. These were Stone Age natives. They had very, very black skin. And they allowed, and they don't wear clothes. They're basically, not clothes. They're out in the sun all the time, but their skin is very, very dark. And they allowed this group to draw blood, and their level of vitamin D was also 60 nanograms per ml. So it's a very interesting point about how you really cannot get too much vitamin D from the sun,
Okay.
and it's safe, but as to how much you need would depend on the latitude and the season.
Okay. Thank you, Professor. And the last one question is about HIV, that the supplementation in HIV and tuberculosis. What do you recommend?
Yeah. sorry, I don't know anything about HIV, but certainly tuberculosis. I think all the work has shown that the levels have to be. I don't know what the numbers are, but if you ask me what the levels should be in somebody who's being treated for tuberculosis, I would be pushing levels of 50 to
Okay.
60. I think you really have to be sure that the levels are adequate. So I would be much more aggressive in getting levels to the upper range of normal.
Okay, and in the patients after COVID-19 infection, there is any place for the use of vitamin D as a supplementation after COVID-19?
I don't know. It's a very good question. We're learning about all these post-COVID syndromes and how I don't think there have been any studies looking at the post-COVID period and whether or not vitamin D might have it. That's a very good question, and I actually don't know the answer, and I'm not aware that that's actually being studied.
Maybe an interesting study for this year.
Yeah.
Okay, Professor. Once again, thank you so much for your wonderful presentation. It's a pleasure to see you again online at this time. And we hope in the Peruvian Diabetes Association to see you next year in person here in Lima. And thank you so much. And my last words in Spanish is muchas gracias a todos los asistentes. Gracias por participar en las actividades. En un par de semanas tenemos otro invitado y continuamos con los temas de COVID-19. Professor, once again, thank you so much. We hope to see you next year here in Peru.
Okay, Miguel, thank you so much for inviting me, and I look forward to see you for real next year in Peru.
Ok, thank you. Muchas gracias a todos los participantes. Nos vemos en la próxima reunión de ADIPER. Gracias.